This is the inside of an equine head. This is going to be where your cerebrum lays. This is your cerebri. Down here, this is going to be your optic nerves before the optic chiasm. Oops. This is your sphenopalatine sinus. Right now, we're thinking that this is the orbital fissure, which has 3, 4 ophthalmic of the 5 and your abducens. And then this is the maxillary nerve off the trigeminal. This is where you would do endoscopy through the pharyngeal opening. And this will be your medial pouch and your lateral pouch of the guttural pouches. So I'm going to be talking about the different boundaries. The medial boundary will be your septum and the longus capitis muscle, which is the main flexor of the head, and it attaches to the basio-occipital and basiphrenoid bones, which you can see right here. This is the basiphrenoid bone, and this is a septum right here. So that's the medial boundary. And then your lateral boundary is going to be the pterygoid muscles, which we think are these right here, and coming down here. So this is going to be your lateral boundary. And also, what you can't see here, you're going to have also parotid and mandibular salivary glands, which is lateral boundary. And then dorsally, the boundary will be the base of the skull and the atlas, and occipital condyle. That's going to be dorsal. And then ventrally are going to be the pharynx and the esophagus. If you actually go down here, you can feel like the esophagus and larynx area, that hole. And on the floor of the pouch is the medial retropharyngeal lymph node. And so when it gets like swollen or there's inflammation, the guttural pouch will actually push ventrally instead of dorsally because it can't push against the bone. So you will have respiratory problems going ventrally pushing against the esophagus and pharynx. And the stylohyoid bone divides the guttural pouches into the medial and lateral pouches.
The lateral pouch is 1/3 the size of the medial.
Yeah, the lateral pouch is 1/3 the size of. This is 2/3 size, and this is 1/3 size. This is your external jugular. Right here, we found the cranial cervical ganglion next to the internal carotid. And I think that's it. This is probably your mandibular bone. And I think that's it.